A sudden wave of shock has swept across the United Kingdom today, and the nation finds itself confronting a crisis unlike anything it has faced in recent memory. Just moments ago, an unprecedented paramedics and emergency medical staff officially walked off their duties, leaving entire regions exposed, vulnerable, and on the edge of collapse. As of this hour, emergency response zones have either entirely broken down or are operating at critically reduced capacity, creating what experts now describe as the most severe disruption to emergency healthcare in modern British history. From the very first minute this walkout began, the emergency system started unraveling in ways previously unimaginable. Dispatch lines lit up with incoming calls, yet operators on the other end could offer little more than apologies, warnings, and pleas for patience. Many callers were met with a chilling message: no units available. Those three words, repeated hundreds of times across the country, have left countless families terrified and helpless. In some parts of England and Wales, residents are being advised to transport patients to the hospital themselves, a recommendation almost unthinkable in a nation that has long prided itself on rapid, reliable emergency care. Outside dozens of ambulance stations, paramedics, the very people who have spent years rushing toward danger, now stand outside holding placards and banners. Some walk in circles, others huddle near portable heaters, and many stare silently at the rows of idle ambulances behind them. These vehicles, once symbols of life-saving urgency, now sit parked in eerie stillness, their lights off, their engines cold, their crews pleading for the reforms they say are necessary to prevent this emergency system from collapsing entirely. For many of these workers, this strike isn't about salary or overtime, it's about safety, dignity, and the fundamental ability to save lives without destroying their own. By mid-morning, the consequences of the walkout began to materialize in dramatic fashion. Major hospitals in London, Birmingham, Manchester, and Glasgow reported waiting rooms packed beyond capacity, with people arriving by taxi, private car, or even being carried in by family members. Footage circulating on social media shows panic-stricken relatives rushing through hospital doors, desperately calling for help while staff scrambled to manage the overflow. Doctors and nurses, already stretched far past their limits, are now juggling cases that would normally be stabilized long before reaching the hospital. Consultants are warning that delays of 1 to 3 hours for life-threatening emergencies could result in catastrophic outcomes. Government officials, scrambled and overwhelmed, have attempted to reassure the public, though their messages have done little to calm the rising outrage. At the morning briefing, a spokesperson insisted that military personnel and volunteer responders were being deployed to fill some of the gaps. The paramedics are that replacing fully trained professionals with short-term stopgaps is both unsafe and unsustainable. You can't just drop someone into an ambulance and expect them to handle the reality of what we face, one striking paramedic in Leeds explained. This job breaks you if you're not prepared, and the system is breaking us even when we are. Unions representing emergency medical staff say they have been ignored for years as conditions deteriorated and response times spiraled out of control. Their demands, they say, are not unreasonable: secure staffing levels, safer shift patterns, updated equipment, and pay that reflects the level of responsibility they carry. Yet, despite countless meetings, negotiations have repeatedly ended in deadlock. For many workers, today's walkout is not a choice, it is a last resort born out of desperation and emotional exhaustion. As the day progresses, scenes of community-driven support begin emerging across the country. Neighbors knock on each other's doors, checking on the elderly and vulnerable. Volunteers trained in basic first aid step forward to offer help where they can. In several towns, people have begun organizing informal transport networks on social media, offering lifts to hospitals for those in urgent need. Though these acts of kindness showcase the resilience of British communities, they also underscore the magnitude of the crisis. Citizens are now doing what the national emergency system usually does. Inside emergency control centers, the atmosphere is tense and surreal. Operators accustomed to dispatching ambulances within moments are now forced to deliver grim news repeatedly. One call handler described it as the worst day of my career, explaining that they had never felt so powerless. We're trained to solve problems quickly, they said, but to date, there's nothing we can do. The screen keeps filling with calls, and we have nowhere to send anyone. Meanwhile, political leaders face growing pressure from every direction. Opposition parties accuse the government of allowing a predictable crisis to spiral out of control, pointing to years of warnings about rising burnout rates, deteriorating conditions, and dangerously slow response times. Members of the ruling party insist they are working to reach a compromise, but public confidence is rapidly diminishing. Reports from Westminster confirm that emergency meetings have been held throughout the day, though no concrete solutions or concessions have been announced. The impact of the strike is radiating far beyond hospitals and emergency control rooms. Schools are sending out advisories urging parents to exercise caution. Large-scale public events including football matches, concerts, and winter festivals are being forced to consider postponements due to inadequate medical coverage. Even major airports, such as Heathrow and Manchester Airport, have raised internal risk levels due to limited emergency support. The message is clear: the emergency response system is the backbone of national safety, and without it, every part of daily life becomes uncertain. As afternoon turns into evening, the true emotional weight of the crisis becomes strikingly apparent. Outside Thomas Hospital in London, a small crowd gathers around a woman who begins to speak to the media. Her voice trembles as she describes how her father collapsed earlier in the day. She dialed immediately, only to be told that no paramedic could reach them in time. She and her brother carried their father to the car and drove at full speed to the nearest hospital. He survived, but only because they acted fast. Tears stream down her face as she says, "I don't blame the paramedics. They've saved my family before. But the fact that they weren't available today, that's on the people who ignored this for years." Her testimony spreads rapidly online, gathering millions of views and sparking a fierce national conversation. Many express sympathy for the paramedics, others voice anger toward political leaders, and some are simply terrified at what the next few hours might bring. The public mood is a mixture of fear, frustration, and deep uncertainty. By the time night settles over the Arc, the country feels eerily quiet. Streets that usually echo with the sirens of rushing ambulances are still. Hospitals glow under streetlamps full to the brim, their corridors overflowing. Ambulance depots sit in silence, with workers gathered beside their vehicles, shoulders stiff from the cold, hearts heavy from the weight of what they know is at stake. Yet even in the midst of this chaos, something else is happening. The nation is waking up to a truth paramedics have known for years: a system stretched this thin cannot survive without fundamental change. The walkout, though disruptive and frightening, is revealing the underlying fragility of a service the British public has long taken for granted. And as midnight approaches, one question echoes louder than any other. How long can Britain endure this crisis before something breaks beyond repair? The answer may depend on what happens in the coming hours, whether leaders finally step forward with real solutions, whether negotiations resume with urgency, and whether the system can be stabilized before more zones collapse under the pressure. For now, the nation remains tense, vulnerable, and holding its breath, hoping the people who have always been there in the darkest moments will soon be able to return to their posts not weakened, but supported, heard, and valued. The story continues to unfold, minute by minute,